I'm Annie Lorenzo. I am a mother of two beautiful girls, Elena, who is 7, and Miss Eva, who is 6. We live in the mountains in Colorado, are very, very active, have 2 fur babies, 2 Bernedoodles that are brother and sister as well, that are a big part of our lives. I have been in healthcare technology my entire career and really understanding and bumping up against the healthcare system, and really kind of recognize that my youngest, Miss Eva, was not hitting her milestones the way she should have been very early on, and ended up trying to navigate the healthcare system to get her tested, which I ended up doing when she was about 12 months old. And we got our diagnosis that she's on the spectrum. So is living with autism and is also dyslexic. So a kiddo that needs a lot of support right now. The impact was really strong on the family. It was hard. It's not easy to hear that your kiddo needs extra help, that her brain's wired differently, that she's neurodiverse. And what does that mean for her and her life? What does that mean for her schooling? What is she going to be able to do? How is she going to interact socially? Is she going to have friends? Is she going to be happy? All of those things go through your head. And it was a panic moment. It was, what do I do? How do we do this? Who can help? What is it going to cost to support this kiddo? I ended up having to pay out of pocket to get that kiddo tested by a private psychiatrist because the wait at Children's Hospital was over a year. And all the research and everything I've read was early intervention is the only way to go to help this kiddo longer term and achieve a happy life. There's not a clear path or journey to follow. There's no clear, you do A, B, C, D, and then you're going to get these results. I feel like it's very wild, wild west right now on what's the right journey, what to do, how to support the kiddo, even just learning about ABA therapy and the benefits of that. And how do you find a high quality, good ABA therapist? What is the plan? And is it specific for my kiddo? What are we going to do to help Eva on her journey and what she needs and what's working and what's not working? And it's overwhelming. The amount of articles and opinions and research is really overwhelming in terms of where to start in the journey and what that right path and next step is. And it's also learning how to advocate and figuring out how to use your voice as a parent for the school, with primary care, with pediatrician, on the medical side. And it's really figuring out what are the right questions to ask as well, and being okay, really trying to figure out how to navigate. And you may not get it right, but just continuing to try and to push. There's not a clear pathway today. It's really important to me to try to improve this process, try to improve how to diagnose kiddos much earlier than they're getting diagnosed, and then how to create a really clear journey for parents and for kids that are specific to their needs. It is not a one size fits all of, okay, you need 12 ABA therapy visits in a week, or you need 10, or you need to do this. It's how do you really carve out and structure a program, a technology, a network that can really support all of these parents with not only what to do, but have confidence that these kiddos are getting the right care and that it's cost effective as well. I would say take a deep breath. It's okay to feel all of the emotions, and that there's help out there. And it's finding the right resources and the right support and taking it a day at a time. And it's okay to feel scared. It's okay to feel lost. It's also okay to know that you have the best kiddo in the world, that they're just a little bit different and that they will be just fine. And it's really taking those emotions and being okay with them, and then continuing just to figure out how to navigate to support your kid every day. I feel lucky that I was in the healthcare system and even educated to know where to start. And a lot of parents do not know. A lot of parents won't find out till their kids are in school that there may be a neurodiverse issue. The kiddo may need a little bit of help. And that is a really challenging, complex journey to navigate with your kids. And it is companies like Sunstone that are really trying to jump in and make a difference and really try to put the mission first, which is parents and kiddos first, and do the right thing for kids and do the right things for families, And it's companies like this, like Sunstone, that are actually going to make an impact and a difference. And that brings me so much joy and hope for all kids that are neurodiverse or having other issues, that there are people out there that care and that are working on fixing this completely fragmented system right now.